North Carolina House representatives say a recently passed House bill hopes to improve health care on the local level. HB 246 starts by supporting small-town pharmacies, especially in rural areas. Now, your side, Sarah Gray-Barr spoke with the bill sponsors today. She joins us now. And Sarah Gray, who is this bill supposed to help?
Ken, bill sponsors say the bill helps local mom and pop pharmacies because oftentimes these small businesses, they just can't keep up with big pharmacies. Those I spoke to say House Bill 246 levels the playing field when it comes to drug distribution and health care. House Bill 246 targets pharmacy benefit managers, or PBMs. These groups serve as middlemen between insurance providers, drug companies, and pharmacies. Primary bill sponsor Representative Chris Humphrey says these PBMs can hurt independently owned pharmacies.
The independents have to contract with the PBMs so that they can have access to drugs, but it's almost like a monopoly. They don't have many choices, and they're forced to sell products below cost.
One way PBMs make money is through spread pricing.
They will keep the difference between what they charge you to fill a prescription as the policy holder and what they pay the drugstore to fill a prescription.
Humphrey adds the bill restricts spread pricing, fees, and rebates, practices that hurt both independent pharmacies and consumers.
It'll give customers more choices, lower drug costs, greater access. You know, rural areas are suffering the most in North Carolina. I mean, there's not as many doctors, not as many pharmacists.
Representative Wayne Sasser has a background as a pharmacist. He says this bill will increase transparency in health care.
We want to know how they're running their business. We want to know how it impacts the cost of health care.
The support has been unanimous, passing in the House with 114 votes. In a statement to WNCT, Representative Glorstein Brown stated in part, "The way the current law is written provides an unfair advantage to pharmacy benefit managers, and it's clear that we need to make some changes." Since House Bill 246 passed unanimously in the House, it now sits in the Senate waiting for further consideration. In studio, Sarah Gray-Barr, 9 on your side.